Hello, have you called for an ambulance?
That's gone down as a 1 hour, as an urgent.
And what town or city is that in, please?
And her date of birth, please.
My role as a specialist paramedic in the Emergency Operations Centre is to identify calls coming in which will be suitable for an alternative response.
I've learnt a lot working within the multidisciplinary team. The patients have benefited because we can get the team involvement quicker to the patient. The role of the paramedic was the element that was missing.
The ultimate aim of a paramedic rotating pilot is to be part of the wider healthcare system.
Doing the rotational paramedic has given me a really interesting insight into different areas of community care.
For me, working within the GP surgery as part of the rotation, it's about what I learn here, taking into my next rotation, and how I can benefit not only patients but the shared learning with colleagues.
We're trying to show a different way of working between the ambulance service and the GP practices. And if we can change that system, then we're going to make great steps forward.
Ensuring that we can get the right skill to a patient at the right time prevents a patient having to be taken to hospital. The rotating paramedic is in 3 parts, rotating into 3 places: the command room, doing the hear and treat, looking for patients that they can dispatch and treat at home rather than calling a 999 ambulance. The GP practice, often doing urgent calls, and working with other community staff out and about in people's homes.
Working within the practice, what we're helping to do for patients is getting the patient to the right place at the right time by the right person, instead of the traditional going through the A&E process.
Being involved in the GP's practice, it gives me clinical mentorship, clinical leadership. It gives me a chance to practice my skills and knowledge to ensure that they're up to date.
The advanced paramedic and the specialist paramedics within the Emergency Operations Centre will target the most appropriate 999 calls where we know we can avoid the patient being taken to hospital.
Obviously we don't see the patient, we're only reading information about them, but the skill set that we have allows us to interpret that information. We bring the outside into the centre.
Within the multidisciplinary team, we've been working alongside different professionals, occupational therapists, physiotherapists, district nurses. Being on A&E all of the time, I've been doing it a long time now. You do get a bit stagnant with it, and this has sort of given me a new motivation.
Paramedics sometimes leave the ambulance service because they want to extend their skills. Likewise, paramedics want to come back to the ambulance service because they miss certain elements.
One of the exciting things that Health Education England were looking at was the career opportunities for the paramedic. Offering them other opportunities wider than the ambulance service is really helping in terms of ambulances retaining their staff. But more importantly, the wider health and social care community are looking for solutions to manage the growth in the demand for both primary and urgent care, and the rotating paramedic project is ideally placed to be a major part of the solution for that problem. There have been really good pockets of good practice across the country over the last 2 decades, but I think what's different now is there is a true lens being shone upon the paramedic role and what people can do.
This gives paramedics something to aim for. Their knowledge base will be increased, and it's the best job in the world.